Hello everyone, welcome to this lecture on asthma and we are going to start with the introduction and then we are going to understand the pathogenesis of this very important respiratory disease. So then we are going to start with the introduction of the asthma, then we will move forward to the pathogenesis and then we will see the various morphological changes that occurs in the asthma, including airway remodeling. As you can see here, it is the normal human body, including normal lungs with a normal bronchi, which are relaxed, allowing easy airflow. So, in introduction, asthma is a chronic inflammatory disease of the airways in which airways becomes hyper-responsive. A very important term is there, hyper responsive, and the airways are associated with inflammation and obstruction. Okay, so as you can see here that the muscles of bronchi are tight and thickened because of inflammation and there is mucus. Okay, so all this leads to the obstruction of the pathway, which leads to the difficulty in breathing. Okay, so all this is happening in the asthma. So if you have seen the patients of the asthma, they are usually associated with the wheezing, there is breathlessness, there is chest tightness, and there is always coughing present. Okay, so the patient is usually the coughing as well as there may be wheezing, there is chest tightness, and there is shortness of breath. So there is difficulty in breathing, and mostly the symptoms are particularly at night and in the early morning. Okay, so these are the recurrent episodes which are present in the asthma patient, usually in the night and in the morning. So now we will see the pathogenesis. So then there are many phenotypes of the asthma, but the most common one is the allergic asthma. It is the most commonly found, and the most patients are associated with allergic asthma, and it usually begins in the childhood, but it is not necessary. Okay, and usually they are associated with other allergic diseases such as eczema or allergic rhinitis. Okay, all this is present in the patient usually. So all the allergic things are present in a patient. Okay, and the most common allergens are house dust, mites, which are usually found in the pillows or some mattresses, etc. Seasonal pollens are a very important cause of this allergic asthma, as well as pests are there. Okay, so all these allergens induce asthmatic symptoms as we saw, and all this leads to the recurrent episodes of wheezing and breathlessness and coughing. Okay, all this is there. Okay, and inhalation of allergen in the airway is usually followed by an early phase response and late phase response. Let's start with the early phase response. So in the midst of this pathogenesis of the asthma, there are mast cells. Okay, so these mast cells are activated by the allergens, and these mast cells activation leads to two waves of reaction. First is the early wave or immediate phase reaction, and second one is the late phase reaction. In the early phase reaction, usually the single episode of asthma is present there, and in the early phase there are release of various bronchoconstrictor mediators such as histamine, a very important mediator, as well as leukotrienes and prostaglandins such as LTD4 and PGD2. So all these mediators leads to the airway smooth muscle contraction. Okay, so when the smooth muscle is contracted, it leads to the breathlessness or the feeling of chest tightness, as well as there is vasodilation, there is microvascular leakage and plasma exudation. So there is formation of the mucus here. Okay, so all this is in the early phase reaction. So in the early phase there is bronchoconstriction. So we have to treat this bronchoconstriction by giving some bronchodilators. Okay. Now in the late phase reaction, what really happens that it is basically inflammatory in nature. Okay, so in the late phase, of course, there is activation of mast cells, as well as there are infiltration of eosinophils, lymphocytes. Okay, so all these are present there, and the presence of these leads to the inflammation. In the lymphocytes, T helper 2 lymphocytes are present, as well as innate type 2 lymphocytes or ILC2. So all these mast cells, eosinophils and lymphocytes leads to inflammation in the late phase reaction. So if there is repeated triggering of the bronchial wall due to the allergens or some other reasons, also if there is repeated inflammation, it will lead to the airway remodeling, which will lead to the structural changes, and the most important changes are increase in the number, that is hyperplasia, and size, that is hypertrophy of airway smooth muscle cells. Okay, so there is thickening of the smooth muscle cells. Okay, as well as there is angiogenesis, there is mucus secreting cells, that is goblet cells. Hyperplasia is there, so a lot of goblet cells are there, and they will secrete a lot of mucus, as well as there is fibrosis of the sub basement membrane. Okay, and if there is fibrosis, then it will become very difficult to treat them. Okay, so all this leads to the irreversible component to the obstructive disease. Okay, so all this remodeling will leads to the obstructive disease. Okay, then it will become the fibrosed. Okay, so all these changes are very important to understand. We will see them. So here is the party that will start when the pollen will enter. A very important allergen, when it will enter, then it will activate the dendritic cells. So the dendritic cells are very important here. The dendritic cells, when they are stimulated, then they regulate the T helper 2 cells. Okay, so the TS2 lymphocytes are activated, and they will release the interleukin 4 and interleukin 5. So the interleukin 4 will activate the B cells, and these B cells will release the IgE antibody, a very important antibody which is formed in the asthma. So this IgE antibody will bind to the Fc receptor of the mast cells. So the IgE mediated activation of the mast cells will lead to the release of various mediators, including interleukin 5. Okay, so the interleukin 5 from the TS2 cells, interleukin 5 from the mast cells will lead to the recruitment of eosinophils. Okay, as well as one more chemotactic factor is there, known as eotaxin. Okay, so this chemotactic factor also will lead to the recruitment of eosinophils. Okay, so the dendritic cells will regulate TS2 cells that will drive the eosinophilic inflammation, and by the IgE formation by B lymphocytes. So all this is there. Okay, so when the pollen will enter, it will activate the dendritic cell. The dendritic cell will activate T helper 2 cells, the TS2 lymphocytes. It will release interleukin 4, interleukin 5. Interleukin 4 will activate B cells. B cell will release IgE antibodies. These IgE antibodies will activate the mast cells, and these mast cells will leads to the recruitment of eosinophils. Okay, so when the eosinophils are there, it will also leads to the release of various mediators. All this is very important to understand. Okay, not only in the case of allergen, as well as in the Non-allergic asthma, there is also activation of eosinophils. Okay, and it also orchestrated by the TS2 cells and ILC2 cells. Okay, so in the non-allergic asthma, there is recruitment of eosinophils there also. Okay, so here you can see that it is the normal airway. There is a mild mucus and some goblet cells are there. There is epithelium. There is a thin basement membrane. There is lamina propria. There is a thin smooth muscles and there are some glands, and this is the cartilage. Okay, so it is a simple diagram of the bronchial muscle tissues. Okay, however, in the asthma, this chronic inflammation will leads to the various changes. Okay, what changes? A lot of mucus, many goblet cells are there. They will produce a lot of mucus, as well as there are eosinophils here. Eosinophil recruitment is happening there and the party is going on here. There are many cells such as macrophages, mast cells, eosinophils, neutrophils, lymphocytes. All these kind of cells are here. So the party has started due to the chronic inflammation, and there is thickening of smooth muscle cells, means hypertrophy and hyperplasia of smooth muscle cells is there. There are many gland cells are there. So all these changes are happening, and all this is known as airway remodeling. Okay, airway remodeling is there. Okay, submucosal fibrosis is also present there. Okay, so all this is happening because of repeated bouts of inflammation. So the eosinophils are the key inflammatory cells which are found in almost all subtypes of asthma, and the eosinophilic recruitment is orchestrated by the TS2 cells. We saw that, as well as ILC2 cells. So eosinophils and lymphocytes are very important inflammatory cells that are involved in the pathogenesis of asthma. So then we saw the various morphological changes that are happening in asthma. We saw the airway remodeling. Now some very important points are here, such as Curschmann spirals which are formed, and these are thick tenacious mucus plugs which contains walls of shed epithelium, and there are numerous eosinophils, we saw them, as well as there are formation of Charcot-Leyden crystals. Okay, so the Charcot-Leyden crystals, what are these? These are crystalloids made up of eosinophil protein galactin 10. Okay, so this galactin 10, it feels like some kind of galaxy. So this galactin 10, okay, this leads to the formation of Charcot-Leyden crystals. You can learn by the ACC cement, A for asthma, C for Curschmann spirals, C for Charcot-Leyden crystals. Okay, so ACC cement, all this is the morphological changes. Thank you. To subscribe, like and share. So then what knowledge we gain today? We now know that the asthma is a chronic inflammatory disease of the airways, which involves the recurrent episodes of wheezing, breathlessness, chest tightness, and coughing is there. And the most common is allergic asthma, in which there is activation of mast cells by the allergens, which leads to the release of bronchoconstrictor mediators such as histamine, LTD4, and PGD2, and there is infiltration of eosinophils and the TS2 lymphocytes and ILC2 lymphocytes. All this leads to the late phase reaction, and there is involvement of dendritic cells and IgE formation is there. All this leads to the airway remodeling, that is morphological changes are there, such as hyperplasia and hypertrophy of airway smooth muscle cells. There is angiogenesis. There is a goblet cell hyperplasia. So a lot of mucus secretion is there, as well as there is sub-basement membrane fibrosis, as well as there is formation of Curschmann spirals and Charcot-Leyden crystals. You have an assignment. Share in the comment section what are NSAID induced and exercise induced asthma. These are the references. Thanks a lot.